Good day to you, learners. You are welcome to this session, that is Introduction to Perioperative Nursing, NSC 509. My name is Oyedeji Waipo, and together with Mrs. Adeleke Efo, as we have discussed during the introductory video, we shall be taking this course concurrently. Now, today, as I've earlier said, we'll be discussing Introduction to Perioperative Nursing. Sit back and watch. What are the learning objectives for this study? That is study session 1. Having heard of this study session, you should be able to discuss perioperative nursing. You should be able to discuss the strengths in perioperative nursing. You should be able to explain different types of surgery we have. You should be able to describe the perioperative nursing themes. What is perioperative nursing? Perioperative nursing can be defined as the specialized nursing care provided to patients before, during, and after surgical procedures. Perioperative nursing encompasses a wide range of activities and responsibilities aimed at ensuring the patient's safety, comfort, well-being throughout the entire perioperative period. Talking about this perioperative nursing, as a perioperative nurse, you work closely with the surgical team, including the surgeons, the anesthesiologists, and other healthcare professionals, in order to coordinate and deliver comprehensive care to your patients. What are the phases of perioperative nursing? There are 3 phases of perioperative nursing. The first one is pre-operative phase. The second phase is intra-operative phase, while the third phase is post-operative phase. Now, talking about pre-operative phase, this phase begins when the decision for surgery is made and continues until the patient enters the operating room. During perioperative phase, that's when you do the assessment of the patient. That's when you take the informed consent. You seek the consent of your patient if the surgery should hold or not. During this phase, perioperative nurses conduct pre-operative assessment. You assess your patient from head to toe. You provide education based on the planned procedure for the patient, and you also support the patient, including the family members. At this period, patients and relatives might be going through a lot of psychological problems, because they don't know how the surgery will end. So at this stage, you need to provide education. You need to give psychological support to the patients in preparation for the surgery. And then at this stage, you address any concerns and questions. Okay? The next one is intra-operative phase. Intra-operative phase encompasses the time when the patient is in the operating room undergoing the surgical procedure. Okay? And perioperative nurses in this phase assist in setting up of the operating room. You are responsible for the setting up of the operating room. You maintain a sterile environment in order not to contaminate the procedure, in order not to contaminate the sterile field. Then at this stage, you collaborate with the surgical teams to ensure patient safety and monitor patient vital signs. During this phase, you monitor patient vital signs as required. You monitor patients, you check the anesthetic machine, whether they are working or not. Okay? Then you also assist with the administration of anesthesia. You manage surgical instruments as well as equipment. Then you provide immediate support as needed. Post-operative phase, which is the third phase of perioperative nursing. This phase starts when the patient leaves the operating room and continues, or the patient has fully recovered from the effects of anesthesia and surgery. Perioperative nurses at this stage focus on monitoring the patient. At this stage, you monitor the patient very well. When the patient is still in PACO, you monitor the vital signs every 15 minutes for the next 2 hours. Later, you still monitor for the next 30 minutes. For 30 minutes for the next 2 hours until patient recovers. Okay? Then at this stage, you manage the pain. You don't allow patients to go through pain, to go through discomfort. you monitor, you administer the pain relief, the analgesic as prescribed by the physician or the surgeon. And at this stage, you provide post-anesthesia recovery care. You cover your patients, you provide warmth, due to the effect of anesthesia. Patients at this time may be feeling cold, so you provide warmth. You take care of the patient very well. You assist with the transition to the post-operative unit, or if it's a day case, you discharge home. So you also educate patients at this stage. You educate the family on post-operative care instructions. Any potential complications, you prepare their mind, and you give follow-up appointments. The next is trends in perioperative nurses. As baccalaureate nurses, we have to keep abreast of our colleagues. You have to know what is in vogue in our field. So, perioperative nurses require specialized knowledge, skills related to surgical procedures. There are so many procedures. There are a lot of advancements. You go abroad, we see robots assisting in surgeries. All these sophisticated equipment, they are now available even in our country now. So, the aseptic techniques, anesthesia management, and post-operative care, there are new trends. So you must gain specialized knowledge and skills in this aspect. The perioperative nurses must possess excellent communication skill. As a nurse, you should be able to communicate with your patients, with your colleagues, and patient's family. So you must have excellent communication skills. You must have good listening skills. You must be able to ask questions, and you allow your patients also to ask questions. At the same time, you should be able to collaborate with others. So you must have collaboration skills to work effectively as part of a multidisciplinary team. Okay, when you are working as a perioperative nurse in the theater, you can't work in isolation. You work with other people in that department. Okay. The next is trends in perioperative nurses. As baccalaureate nurses, we have to keep abreast of our colleagues. You have to know what is in vogue in our field. So, perioperative nurses require specialized knowledge, skills related to surgical procedures. There are so many procedures. There are a lot of advancements. You go abroad, we see robots assisting in surgeries. All these sophisticated equipment, they are now available even in our country now. So, the aseptic techniques, anesthesia management, and post-operative care, there are new trends. So you must gain specialized knowledge and skills in this aspect. The perioperative nurses must possess excellent communication skill. As a nurse, you should be able to communicate with your patients, with your colleagues, and patient's family. So you must have excellent communication skills. You must have good listening skills. You must be able to ask questions, and you allow your patients also to ask questions. At the same time, you should be able to collaborate with others. So you must have collaboration skills to work effectively as part of a multidisciplinary team. Okay, when you are working as a perioperative nurse in the theater, you can't work in isolation. You work with other people in that department. Okay. Trends in perioperative nurses continue. So perioperative nursing is a dynamic field that continually evolves to meet the changing needs of surgical patients and advancements in surgical techniques. So there are trends which have emerged in perioperative nursing in recent years. Here are some key trends. For instance, we have minimal invasive surgery, that is MIS. So the rise of MIS techniques such as laparoscopy and robotic assisted surgeries has significantly impacted perioperative nursing. Nurses, you need to be familiar with all the specialized equipment, instruments and techniques specific to MIS, that is minimally invasive surgery procedures. So they play a crucial role in assisting surgeons during these procedures and ensure patient safety and optimal outcomes. Talking about the trends in perioperative nurses. Enhanced recovery after surgery. That's also one of the trends we have in perioperative nursing. It is also known as ERAS protocols, and it aims to provide or improve patient outcomes and reduce hospital stay by implementing evidence-based perioperative care practices. Perioperative nurses play a central role in implementing and coordinating ERAS protocols, and it includes perioperative optimization, multimodal pain management, and early mobilization and nutritional support. Technology integration is also one of the trends we have in perioperative nursing. Perioperative nursing has witnessed the integration of various technologies to enhance patient care. Talking about the electronic health records is one of the technology integration, that is EHR. It has barcode scanning for medication administration. There are some hospitals that we have to use a barcode scanning in order to administer medication to your patients. We have it in some of the foreign hospitals like UK, US, and the likes. And there are surgical instruments also that we can use to track for tracking system, and they are becoming common in places like abroad. Okay, so nurses need to be proficient while using these technologies, and you must understand the implications for patient safety and efficiency. While using all this technology, you must be proficient. That's why we have trends. So you keep updating yourself. You keep learning new things every day in order to fit into today's practice. Okay. So another one is patient-centered care. There is an increasing recognition of the importance of patient-centered care in perioperative nursing. Nurses are actively involving patients in their care decision. Now you don't take decision on behalf of patients. You involve the patients in decision making. You bring in the patients to decide on what to do. You give options to patients. So addressing their individual needs and providing emotional support throughout perioperative journey. So talking about this patient-centered care, the care must be focused on your patients. You include them, you involve them in decision making. And even while giving health education, you involve them, you let them participate. There's what we call active participation. You allow them to participate actively in their care. You make use of shared decision and personalized care plan. They are the integral to this approach. And next one is interprofessional collaboration. Yes, like I said in the first place, that you can't work in isolation. You work with other healthcare teams, the surgical team. You collaborate among healthcare professionals. You collaborate with them, and it is very essential in any perioperative setting. So as a perioperative nurse, you work closely with the surgeons, anesthesiologists, the surgical technologists, and other members of the surgical team in order to provide adequate care, in order to ensure seamless care delivery to the patient. And the emphasis on interprofessional collaboration promotes effective communication. It also improves patient care outcome, and it gives a safer perioperative environment, provides a safer perioperative environment even to the patients. Now, the next one is continued education and professional development. As a perioperative nurse, you need to update yourself. You need to continue to study. You need to continue to read. There are so many workshops you can attend in order to improve yourself, in order to keep abreast of others. So perioperative nursing requires continuous learning, and you learn, you unlearn, you relearn, and professional development. It is very important. So ongoing education programs, certification, and specified training help nurses stay updated even with the latest evidence-based practices. So technological advancements, perioperative standards, nurses are encouraged to pursue certification like what you have come to obtain in LAUTECH and other specialty, so such as certified perioperative nurses, though we don't have that here. So but you keep abreast, you update yourself in your field. So but pertaining to this perioperative nursing, for those that are interested, at the end of this program you can go for perioperative nursing in order to update yourself, in order to specialize in that field, in order to demonstrate your expertise in the field. So these trends reflect the ongoing efforts to promote patient outcome in order to enhance safety and optimize the perioperative experience. So as a perioperative nurse, you play a vital role in adapting to these trends. You must adapt to these trends. You must be able to make use of all these new technologies, expanding your knowledge and skills, and also it will help in delivering high quality care to your patients whenever they come for surgery at pre-operative phase, intra-operative phase, and post-operative phase. So by embracing these trends, perioperative nursing can continue to evolve and to contribute to the advancement of surgical care. So now we move to types of surgery. Surgical procedures are commonly grouped according to purpose, according to risk, and according to urgency. So let's take it one after the other. First one, according to purpose. The surgical procedures may be categorized based on diagnostic, palliative, and ablative, even constructive and transplant. So talking about diagnosis, you can confirm or establish a diagnosis through a surgery, like biopsy of a mass in the breast. That's an example of a diagnostic surgery. Talking about the palliative, this relieves or reduces pain or symptoms of a disease. It does not cure. It doesn't give a cure to a disease. For instance, resection of a nerve root is a palliative care. It's a palliative form of surgery. Then another one is ablative. It involves removal of a diseased body parts. For instance, one may remove gallbladder, that is cholecystectomy. Okay. And another one is constructive, based on purpose. This one you can use it to restore function or appearance that has been lost or reduced. For instance, in case of breast implants. And the last one is transplants. This one replaces malfunctioning structures. For instance, kidney transplants and the likes. Then types of surgery based on degree of urgency. Surgery may also be classified by its urgency and necessity to preserve the client's life. In order to preserve the body parts or body function. So like someone that has traumatic injury due to accidents. So one may carry out amputation of that affected part. So is a type of surgery based on degree of urgency. Okay, an emergency surgery is performed immediately to preserve function of the life of the patient. And the third one is degree of risk. So surgery is also classified as major or minor according to the degree of risk to the client. Now let's proceed to perioperative nursing teams. There are some of the key members of the perioperative nursing teams. Each member plays a crucial role in ensuring the safety, the comfort, and well-being of the patient throughout the perioperative period. Like I said, that effective communication is very important, collaboration is very important, and coordination among the team members are essential to providing optimal care to the patients in order to achieve successful surgical outcomes. Among the perioperative teams are perioperative nurse. They are registered nurses, and they specialize in perioperative care. They have expertise in perioperative, intra-operative, and post-operative nursing. So perioperative nurses assess patients, you provide education, you coordinate patient care, you also assist in surgical procedure. As a perioperative nurse, you collaborate with other members of the perioperative team in order to ensure the safety of the patient, in order to optimize outcomes and provide continuity of care to the patient. Then the next one is scrub nurse. A scrub nurse works closely with the surgeons and also assist during surgical procedure. They also provide the sterile, prepare the sterile field for the surgery. They handle surgical equipment during surgery and also ensure proper aseptic technique during surgical procedure. Another one is circulating nurse. A circulating nurse, on the other hand, work outside the sterile field. They are the ones that manage the overall of the operating room. They ensure patient safety and also coordinate activities among the surgical team. Circulating nurse, the role of the circulating nurse is to be alert to the needs of the surgical team and also ensure that all surgical supplies are correctly and promptly provided to the operating theatre. So they are also responsible for the management and documentation of all the supplies used in the surgical area. They also perform the role of collecting patient specimen, verifying patient consent form, whether it has been signed or not. They are also responsible for preparation of surgical equipment, and they are also responsible for ensuring an accurate count of instruments even after the surgery. The OGBOMOSO nurse is responsible for the admission and care of the patient who are brought into the pre-operative environment. OGBOMOSO nurse is the one that will check whether the consent form has been signed or not. They admit the patients, to the operating room. They check whether they have all the necessary forms signed, and they check whether the patients has adequate blood for the surgery if there is any need for that. They are also responsible for obtaining vital medication information relevant to preparing patients for surgery and communicating these information to the surgical team. So they inform the surgical team what the information they obtain from the patient, whether the patient is allergic to any medication or if the patient has to take any medication before the surgery. Another one is nurse anesthetist. A nurse anesthetist administer anesthesia and provide care to patients before, during, and after therapeutic, surgical, obstetrical, and diagnostic procedures in the theatre. So this professional can also provide emergency services and pain management. They administer pain relief even during the surgery. They administer anesthesia. They communicate with patients before the surgery to discuss any medications. Also, they are also taking or they are allergic to, in order to ensure the safety of the patient and so that they will know how to administer the anesthesia appropriately. At this stage, a nurse anesthesia must have taken enough information from the patient. That's when you have enough information about your patient will not die on the theatre table. Taking information, relevant information, is very vital to the recovery and success of any surgical procedure. So as nurse anesthetist, you take appropriate information from your patients before you give anesthesia. Some hypertensive patients don't take some drugs before the surgery in order to prevent complication. So this is very important. They play a vital role in the surgery during the surgery. So based on what you have discussed, let me quickly give a recap. Now we have discussed perioperative nursing. We have been able to define perioperative nursing as uh, the delivery of nursing care through the framework of nursing process, which involves collaborating with members of the healthcare team, making nursing referrals and delegating and supervising nursing care. Perioperative nursing is a specialized care given to patients during, before, during, and after a procedure in the theater. So, the field of perioperative nursing includes a variety of nursing functions. The perioperative period consists of 3 phases, like I said: the pre-operative phase, intra-operative phase, and post-operative phase. The surgical procedures are commonly grouped into purpose, degree of urgency, and degree of risk. So those are the 3 groups of surgical procedure. Surgical procedure can be grouped into 3. The first one is according to purpose, the second one is according to degree of urgency, while the third one is according to degree of risk. Now, perioperative nursing encompasses a variety of specialties roles, including holding bay nurse, circulating, anesthetic, scrubbing nurse, and the like. So other roles include patient evaluation, education, and surgeon's assistant. So we also talked about the trends in perioperative nursing, like we mentioned ELAs, using enhanced sophisticated equipment, using we also made mention of patient-centered care, that the patient should be involved in his care, should be actively involved in his care, his or her care. They should be allowed to make decisions even in while going for surgery. So we have come to the end of this session. I would like to give you a scenario. So you are to prepare a patient for abdominal surgery. These are the information of the patient listed very well. Patient's name is John Smith. The age of the patient is 45. The gender is male. Is to be admitted in medical ward. So he has the following surgical ward rather. He has the following history. John has a history of gallstones and has been experiencing recurrent episodes of severe abdominal pain and discomforts. The surgery information is to have laparoscopy, cholecystectomy, that is removal of gallbladder. So date of surgery is July 17, 2023. And the surgeon that's going to perform the surgery is Dr. Emily Julius, while the anesthesiologist is Dr. Michael Johnson. The name of the hospital is University College Hospital. So John Smith has been scheduled for a laparoscopic cholecystectomy due to symptomatic gallstones. The surgery is planned to be performed at University College Hospital, as I've said, on July 17, 2023. How will you prepare this patient for the scheduled surgery? State your roles as a circulating nurse, a nurse anesthetist, a scrub nurse. So you have to state your role before, during, and after the procedure. Thank you for listening. I'll be expecting your feedback. This scenario will be pasted on your discussion forum for you to see. So let's discussion keep coming in. Bye.